My name's Dr. Amy Arrant. I'm an internal medicine doctor specializing in hospitalist medicine in Austin, Texas. Well, I've been practicing here in Austin for 10 years now, and when I first got here, multiple members of my group were getting sued or being named in lawsuits. Our malpractice premiums were just steadily climbing to the point that some of us didn't feel we could continue to practice. The Texas legal reform, it's made my job easier. It's taken away one of the things that hung over my shoulder to worry about. It was every single patient that walked in the door threatened lawsuit. There's been a definite difference, and we can notice it in our recruiting and in our consultant base that physicians are moving back to Texas. In the early 2000s, we had an almost impossible time finding neurosurgical coverage in Austin. And how can you be the state capital and have a major university here and have almost no neurosurgical coverage in the city? People were being shipped to San Antonio for head bleed. You don't need to be shipped an hour away when you have bleeding in your head because there's no neurosurgeon that happens to be practicing in the city because they were driven out of business by malpractice and premiums. And that has changed. From a patient's perspective, I think that the lawsuit reforms and the tort reforms that happened and keeping them in place and not allowing them to be rolled back and changed is very important. Somebody has to bear the burden of those extra healthcare dollars that I spend ordering tests to protect myself. And that payment and that cost gets transmitted to the consumer. Stuff's not free. Somebody pays for it. I am concerned that there's a push, especially by personal injury and trial lawyers, to roll back the changes that were made several years ago, and I'm very pleased that this last legislative session that didn't happen. If it did happen, it would drastically change the way I feel about continuing to practice medicine. Now I think the fairness of the legal system has shifted the right direction. I think that before it was clearly in the side of the trial lawyers, and it felt very unfair.